Hi, I'm Dr. Kelly Starrett with the Ready State. Oftentimes when people have a little bit of a back tweak or they feel uncomfortable or they've just overdone it, they don't really have a good set of strategies to help sort of whisper to the nervous system. How are we going to calm down? Now, the research is very clear that most simple back pain resolves itself in 4 to 6 weeks as a normal kind of typical expression of the human being just getting on with its life. But if you've ever had back pain, you don't really want to wait around 4 to 6 weeks. So here are a couple things that we love to do. Number one, when you're getting up and down, make sure we like to do it from the side. This side loading versus sort of this extension loading where I'm laying down like this, it's a lot easier to get up and down, rolling from the side and rolling from the back. And you don't have to do that the rest of your life, but during those times what we find is that if we take a big breath in and then exhale as we move, that transition with that exhale is actually helping me create high pressure in the trunk, which helps me stabilize. So I can again take another big breath and then exhale and try to breathe through those transitional positions. What we often find is that when people have low back pain, they end up doing a lot of breath holding. And they're kind of going from breath hold to breath hold. And that's certainly one way to try to create stiffness in the trunk for control. But one of the things that we like to say is, hey, if you can't breathe in a position, you don't own that position. So if we can be a little bit more mindful of trying to breathe through, almost like Lamaze breathing, or just taking a big breath in and big breath out while we're in discomfort and in transition, our brains will perceive that as less of a threat. And that is actually a really useful strategy for returning people back to their functions and activities of daily living. Oftentimes we end up holding our breath for repeatedly, actually sort of sensitizes the brainstem to these higher CO2 levels, which makes everything a little bit more twitchy. So what we're proposing here is just trying to take big breaths in, big breaths out as you're transitioning from position to position, shape to shape. And what you'll find is that will help de-escalate some of that low back pain by signaling to your brain, hey, moving is not a threat. Why? Because we're breathing and moving.